click the button here. Today, we're going to talk about hope. If you have stage 4 cancer, fasten your seatbelts. We're going to learn and grow together.
We make mistakes, then we live and learn. When life gets tough and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be. I'll be right here. Right here. And when you need a friend, you can count on me. I'll be right here waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friend. It's so nice we can meet each other on the air on this beautiful best day ever. And if you are listening today, stumbling upon the show, boy, are you in for a treat, because we're going to learn a new truth together. This is a new truth that in 2015 hit me with a 2x4 when many people that I loved had ascended due to the side effects of chemotherapy and radiation. I'm just going to say it as it is. You know, most people die of that, not of cancer. And so if you want to learn anything about this show, the purpose of the show is to provide an alternative way to heal. It is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening friend, will feel empowered to learn a new truth and embrace the life of your dreams. And so today we are going to shock you. This is part 2 of my conversation with Dr. James Forsythe. Part 1 can be found at whenyouneedafriend.com, all the different podcasts, social media. But for those of you who have received a diagnosis of cancer or know somebody, hey, raise your hand. Raise your hand and stand up high if you know somebody, because I bet you 99.9% of you at least know somebody who have been diagnosed with cancer at one point in your life. That is a sad statistic, because cancer doesn't need to happen. And if it does, the body should be able to take care of it right away. But instead, we are told that we have to get chemotherapy and radiation. And so when I met oncologist Dr. James Forsythe back in 2015, I think that was the year I met him, it changed my life. To hear stage 4 cancer, for most of us, we would say, go home, die. And your doctors might even say to you, you got 3 weeks to live, or a month or a year, which nobody knows. Only our Creator who created you knows that. So please fire any doctor who gives you that death sentence. So today we're going to do part 2 of this remarkable healer that he does. What he does is that he helps your body heal. And his name is Dr. James Forsythe. And he has a clinical trial with stage 4 cancers only. And for those of you who have missed the statistics, this is from PubMed. The 5-year survival rate of chemotherapy is 2.1% in the United States, 2.3% in Australia. That is, with the trillions of dollars that we have spent, not acceptable. So it is so important that we become our advocate, that we learn a new truth about healing our body, even stage 4 cancer. And this is a show full of hope, and this is a show that will teach you about Dr. James Forsythe, who is a board-certified medical oncologist, who is licensed as a holistic physician, practicing integrative cancer medicine in the United States. He has authored more than 20 books, including his most recent one called Stoned, The Truth About Medical Marijuana. And so since it is our sole purpose in life to give and receive love and knowledge, it is my honor to introduce you to Dr. James Forsythe. Thank you, Dr. Forsythe, for being a part of the Lillian McDermott radio show and sharing your message of hope.
Thank you, Lily. I'm humbled to be on your program. It's kind of you to this to the attention.
Well, as I mentioned at the beginning, we have done many shows together. We have gone over your credentials. Today, Dr. Forsythe, I want to make this part 2 of the last show that you were on, and not just talk about your protocols, but talk about inspiring stories of hope, of people who were sent home to die that found you and are still, that thrive today, whether they're still alive, maybe 5 years, 6 years later, or maybe live longer than what they anticipated. Is this something that we can do together today, Dr. Forsythe?
I'm sure we can.
So, because we don't have a lot of time during this segment, I want to make sure that those of you who want to learn more about Dr. James Forsythe, you can go to whenyouneedafriend.com. Check out Dr. Forsythe, James Forsythe. He is from the Forsythe Cancer Care Center. You can find him at centurywellness.com. There's other websites that you can find him as well. And so what I want to encourage you, that if you have any questions, you could either text me at 407-373-5959, or you can call them at 977-789-0707. And we're going to continue our conversation with Dr. James Forsythe. He's an integrative oncologist who helps stage 4 cancers thrive. I told you 2.1, he's at 70% success rate. Where else can you just feel so empowered? And we're going to continue our conversation worldwide at whenyouneedafriend.com. We'll be right here waiting for you.
Be right here waiting for you.
Oh, here we go.
Friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
Welcome back to the Lillian McDermott radio show. And if you're just tuning in, you're in for a treat. This is one of the new truths that I've learned. As I mentioned, people thought the earth was flat, and then they learned a new truth, but there's still people who think the earth is flat. They're just as passionate about their truth as the new truth that the earth was a sphere. So we need to discern what is a new truth, what is the truth. And so today, to talk about cancer, stage 4 cancer specifically, for those of you who were sent home to die, listen up, because there is hope today. Dr. James Forsythe is an integrative oncologist and is here to talk about how to help heal your body at any stage. So Dr. Forsythe, thank you so much for being my superhero with a cape. I really appreciate you and the time that you take to explain what's going on in the world with cancer.
Thank you, Lily, again, and it's an honor to be with you this morning.
Yes, thank you. And so for those of you, I mentioned the number is incorrect on the website. The number for Dr. Forsythe is 775-827-0707. That's the proper number if you have any questions that you want to call and learn a new truth about healing your body. Okay, so Dr. Forsythe, as you know, last time we were together, we talked about your protocols. Very quickly, I want to discuss how cancer treatments with like chemotherapy, the traditional cancer therapies, we all know about that. But how is homeopathic or integrative oncology, how does it work? And what are some of the things that you do to ensure the patient can handle whatever you're doing?
Well, Lily, it's very, very simple, and that is conventional oncology. They use dose, really very dose.
We're gonna need to stop the recording. We're gonna need to. Can you?
Let me.
Here we go.
Okay.
When you need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
Welcome back to the Lillian McDermott Radio Show. And if you have stumbled upon this show today, you're in for a treat. We have Dr. James Forsythe. I met him in 2015, and he's changed my life. The information that he has is different than what you'll hear about cancer. And so I want to encourage you, my listening friend, that if you have any questions, you can call 407-373-5959 or text me if you have any questions. But we did a show with Dr. James Forsythe a while ago, and this is part 2 of this segment. Many of you have been told or given a diagnosis of go home and die and wait for that moment to arrive. But if you are not ready to do that, Dr. James Forsythe is the man that you want to speak with. Dr. James Forsythe, I'm so grateful to you for taking your time to speak to us and share what you've learned, the truth about cancer.
Honored to be on your show, and so grateful that you're educating your listeners on this type of therapy has saved.
Okay, so
When you need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
welcome back to the Lillian McDermott Radio Show, where we always learn and grow with one another. And today's teacher is Dr. James Forsythe. Listen up. If you stumbled upon the show for the first time, or if you're a friend of the show who's loyal listener, then you're in for a treat, because talk about finding a needle in a haystack. Dr. James Forsythe is an integrative oncologist who has made it his life, his mission, his passion to help the body heal. And so I have to be very careful about this, because nobody can cure you from cancer, but your body can heal. So Dr. James Forsythe has dedicated his life. He's doing a stage 4 trial. And as I mentioned before, the 5-year survival rate of chemotherapy in the United States is 2.1% and 2.3% in Australia. But Dr. James Forsythe, with his clinical trial, has been around for 7 years. His survival rate of 7 years has been 70%. Imagine that. So if you've been given a diagnosis of go home and die, fire your doctor and call Dr. James Forsythe. He's in Reno, but he's a phone call away at 775-827-0707. Dr. James Forsythe, I'm so grateful for you. As many know, when people get a diagnosis of cancer, they're rushed to slaughter, to chemotherapy or radiation, and you have made it an art to work in a homeopathic or a holistic dose or homeopathic dose. Share a little bit about what is a homeopathic dose and why is it different than what is your protocol when determining what protocols to use?
Well, thank you so much again, Lily.
Thank you.
Homeopathic dose is any dilution of a standard dose.
Okay.
And so in our case, we're using a 10-to-1 dose, which means 10% only. Now, that is a homeopathic dose, and I'm under homeopathic medicine, Lily.
Mm-hmm.
So my protocol, which was started in June of 2010, basically now has 1,300 patients at 7.5 years from the start of protocol. And our survival rate is at 70%.
Amazing.
It does vary a few points up and down because it's a prospective study and we're constantly adding patients.
Yes.
But it does compare favorably. Remember, it's 30 to 35% greater than what is in the conventional literature.
Yeah. Okay, so with that in mind, what impressed me the most, and I've never heard of any oncologist do this, the first thing you do is you check to see if there's any sensitivity to chemotherapy. Can you explain a little bit about that? Because that's so important.
It is, Lily. The chemosensitivity testing is genetic based. So we take the patient's blood. We're looking for circulating tumor cells. And Lily, that blood goes to Greece. We've tried all the other major genetic labs in the world. The one in Greece, the RGCC, is the best. We have no doubt about that. It's been time tested. And so we get a report back in 10 to 12 days, and the report tells 4 things: the best drugs, the best targeted agents, the best supplements, which includes vitamins, minerals, and herbs, and the best hormones, if it is a hormone-driven tumor. By hormone-driven, I mean cancers like breast cancer, uterine cancer, ovarian cancer in women, and prostate and testicular cancer in men.
That's considered hormone cancers?
Those are hormone-driven. That means that hormones play a role in the growth and also the stoppage of the cancer by manipulating the hormones.
Okay, so these are, you're talking about the reproductive organs, like the testicles, the prostate, although the uterus is, but the breast isn't, but that they're all connected with hormones. So let's take that protocol for hormones. Let's start there, Dr. Forsythe. Is your protocol different for hormone cancer than it is for, maybe kidney or lung?
Yes, it is. Literally, when you're dealing with hormonal cancers, you have to consider blocking those hormones if they're stimulating the cancer growth. So you're adding to the low dose chemo and the supplements as needed to block those hormones.
Okay, and so as you block the hormones, then what happens?
Well, let's take breast cancer. Let's say, and I'll use you as an example.
Okay.
If your hormone, when it was biopsied, was estrogen positive, that means that your own intrinsic estrogens are stimulating that cancer's growth.
Okay.
And similarly, in a male with prostate cancer, giving testosterone to a man with stage 4 prostate cancer may cause it to grow faster. Okay,
so in a situation like that, you do not give them testosterone. Let's talk about prostate. If a man has a enlarged prostate, should they have testosterone given to them, like hormone replacement therapy?
Well, an enlarged prostate is called benign hypertrophy. And that's not cancer. So that is not in the same equation.
Okay, but they can still receive testosterone.
Yes, they can.
Okay, perfect. But if they have diagnosed prostate cancer, then how do you block testosterone from a man or estrogen from a woman? How do you do that, Dr. Forsythe?
Well, there are certain natural and chemical big pharma type blockers but many times natural blockers work just as well.
Okay.
In breast cancer, the broccoli extract, the DIM, works very well.
DIM, that's broccoli extract?
Yes, it's DIM, or sometimes called indole 3-carbinol.
Okay. So if somebody has breast cancer and it's estrogen related, they should not take any DIM or DIM.
So they should take.
Got it.
They should, because you want to the estrogen.
Okay. Dr. Forsythe, are you back on the speaker? Go back on. Don't go on speaker because you break up when you do that. Okay, so we want to hear every word that you're saying. Okay, so Dr. Forsythe, so let's say that can you share a story? Of course, we need to protect your patients because of HIPAA. Can you share a story of someone who has stage 4 prostate cancer? How did you treat them, and how quickly did the body recover?
All right, I have several cases. One is a cardiologist who lives in Chico, California, which is just about 3 hours drive from Reno.
Yes.
And it's right over the Sierras.
Yes.
And he was being treated for his prostate cancer in Chico, and he developed metastases or spread to his spine and to his pelvis. And he had pelvic lymph node involvement. He was given 3 months to live. His oncologist in Chico told him to quit his practice, take that last cruise, make amends with his relatives or friends, and enjoy his last few days on hospice.
Wow.
Now, he came to see me several years ago, and his PSA was over 70.
Okay.
I treated him following the genetic testing and with a formula that came up on his gene testing. And with that protocol, within 2 months, his tumors in the spine and pelvis have disappeared, and his PSA was below 0.8.
Oh my gosh.
And he went back to Chico and sang praises and did the happy dance with his colleagues.
Okay, so help us understand why one doctor would say, go home and die, and you would say, no, you still got some music in you, boy. How do you do that? I mean, how do you do that?
I think people are too fast to hang the black crepe and to not give patients a chance. The body has tremendous healing powers if given the right combination of natural therapies and homeopathic dose chemotherapy. So when you're giving a 10% dose, you are giving homeopathy.
So with that in mind, he had metastases in the spine and pelvis. At this point, are you giving him what kind of supplements is he taking? Did he change his lifestyle? What are some of the things he needed to do to help his body heal as well? Because you could only do so much, right?
Well, of course, and part of our therapy includes dietary counseling, eliminating sugars and high glycemic foods, and pH balancing. In other words, making your body more alkaline. All of those things are important along with the supplements. But now the supplements we use are all dictated by his genes. I'm not guessing at anything. I'm taking my direction completely from his cancer genes.
That's amazing.
That's the difference.
This test that you send, it's this DNA test. How much does that DNA test cost, Dr. Forsythe?
Well, it varies with the euro dollar, but it runs around 2,000 to 2,400.
2,000 to 2,400. That's a simple test. It's a $2,000 to $2,400 test that everybody should go through. But somehow, I mean, there's a lot of out-of-pocket expenses when you have been given the diagnosis of cancer. Why not do this for the roadmap? Like Dr. Forsythe says, now I've got a roadmap. I know exactly how to treat you. No guessing, no nothing. This amazing man is on the Lillian McDermott radio show with this wonderful clinical trial. And I'm going to talk to you about, Dr. Forsythe, how people can join your trial, because you're at 1,300 strong. We want to make that number larger. And for those of you who are listening and you cannot believe what this man is saying, Dr. James Forsythe wears, yes, he does wear a superhero costume or cape, not a costume. He's a real deal. 775-827-0707 is his number. And if you have any questions for me to ask Dr. Forsythe, my number is 407-373-5959. Please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com.
I'll be right here waiting for you.
Okay, so this information is so unbelievable, but it's true. And it is time for us to learn a new truth. I think we're coming back. Brian, I think we're going to come back any minute. Or maybe not.
When you need a friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407-373-5959. Once again, here's Lillian.
Welcome back to the Lillian McDermott radio show, where we always learn and grow with one another. You can hear us worldwide at whenyouneedafriend.com. I am your host, Lillian McDermott, and I ask you to consider learning a new truth. Some of the information, when I learned about the truth about cancer and not the truth about the treatment that we were told and only legal in the United States, is chemotherapy, radiation, and surgery. And many, many years later, it's still chemotherapy, radiation, and surgery. And the side effects of chemotherapy are so severe that the survival rate of someone who's had chemotherapy is 2.1%. That's 2.1% 5-year survival rate. Well, I found this little needle in a haystack who is just an amazing man who wears a cape, a superhero cape to work every day, because he does help people learn this new truth, which is what we discuss here on the Lillian McDermott radio show. And if you want to be a part of this movement where we take 100% responsibility for living the life that we desire, I want to encourage you to go to whenyouneedafriend.com. Please become a subscriber. While you become a subscriber, you'll get the show sent to you to your phone and your iPads. So please remember to go to whenyouneedafriend.com, subscribe, and click onto all my social medias, explore and play in the website, and like me, subscribe, and all the different ways that is available to you. You can also call me at 407-373-5959, where we always learn and grow together. Dr. James Forsythe is an integrative oncologist in Reno, Nevada, who's had a clinical trial for stage 4 cancers for 7 years, since 2010. Actually, now we're, so 7.5 years. And so with that in mind, if you know someone that has been given a cancer diagnosis with a metastases or sent home to die, have them listen to this show, please. Because of this, I started the McDermott Holistic Healing Foundation to encourage people to try something different that has been proven not to work. Now, it might work if you're part of that 2.1%, congratulations. But the side effects and the cost for that is so exorbitant. So Dr. James Forsythe, thank you again for being part of the show and sharing your story of one of your patients that had stage 4 prostate cancer with a PSA of 70, and within 2 months, his body was healed. Can you think of other, if it's a let's say the lung, for someone that has lung cancer, what would be, can you recall a patient that stands out as one that you're like, oh, I'm so grateful for this person?
Yes, the next case is a breast cancer patient, a lady with the initials DW,
Okay.
78-year-old, former bank president,
Mm-hmm.
who I first saw in 2010,
Okay.
and when she was diagnosed, and we went through the genetic testing, followed by the 3-week protocol. She remained in an excellent remission until almost 3 years ago now, when she developed some spinal metastases in her sacral spine and her left hip. In fact, she could hardly crawl up the second story of her house, Lily. She had to crawl up the stairs. That's how incapacitated she was with her metastases.
Oh.
She did not get radiation or surgery to her hip. We changed her protocol. We did certain manipulations to cut off her estrogens, and she went on a very, very strict diet and went very heavily on the supplements that we had administered. She's now in a complete remission. She is being also cared for in Las Vegas, her home, by Dr. Daniel Boyle, who does autologous stem cells as well. But she has been in an excellent remission for the past year and a half.
That's amazing. And so because she had been your patient before in 2010, did you have to do another DNA test, or was it the same roadmap the second time around?
We did a second Greek test in order to find, because cancers naturally mutate. So older drugs that came up before as valuable sometimes disappear, and newer drugs will appear. May not even have been discovered at that time, because that was 7.5 years ago. And also supplements do the same thing. Sometimes newer ones pop up and older ones are no longer effective, simply because the metabolic characteristics of the cancer have changed.
Okay. So why is it that cancer returns in some patients and may not return in others? Is that a nutritional change, or is that, cancer, an emotional aspect component? Because, I've done shows here that says that every disease has an emotional component. So what is your assessment, Dr. Forsythe, and your research shown why some people get cancer back and why do others not?
Well, Lily, it's a combination of all of the above that you've mentioned. It could be stressors extrinsic to the body, say you're going through a divorce, losing a child, the death of a parent. It could be loss of a job. It could be constant worry over their cancer. It could be an illness that comes in and knocks down the immune system, like a bad case of the flu or pneumonia, or an auto accident that causes severe trauma that triggers the cancer to life again. Oftentimes cancers do lay dormant for years. In fact, breast cancer can reappear as long as 20 to 30 years later.
Wow. Okay, so with that in mind, Dr. Forsythe, when we are looking at our body and saying, okay, so my cancer has gone into remission, and now I'm going to live my life the way I need to live it, how important is it to deal with some of these issues that cause the body to dis-ease, or the body dis-ease? How important is it for someone to dig deep with a soul shovel and discover these darker sides of our life that we're unwilling to look at, how important is it to dig until we resolve, forgive, and love ourselves for that experience?
Well, that's extremely important, no question about it. It's one of the goals of our therapy is to use all of these modalities that help in curing the cancer. Remember, cure is defined as the absence of any measurable disease by any means of testing. And a cure, Lily, means being in complete remission for at least 3 to 5 years.
Mm-hmm. Wow. Okay. So let's say I want my body to be healthy, which we all do. What are some of the supplements? Can we do this DNA test, this Greek test, just to see what our body needs at that moment? Even without cancer, would we be able to do and benefit from this test?
An excellent question, and it comes often from patients, but unfortunately there's no testing. Because of the expense of the test, it's not done routinely on healthy people.
But what if somebody's willing to pay for it?
If they are, we certainly can do it. Or if they have a strong family history, say they have a Lynch syndrome or they're BRCA positive, Lily,
Mm-hmm.
they may want to do the test just to see what's available.
And so at that moment, that test will show you what's deficient in the body, what would work, what supplements would work best. And before even getting to, because, if you have 50%, possibility to get cancer in this BRCA testing, there's still 50% that won't get it. That's the 50% we don't talk about. So if we were to be proactive and say, okay, I'm going to do this DNA test to see what my body is deficient from, does that make sense? Is that something that can be done?
It can be done, certainly, but it's not done that often, but it certainly is an option for patients.
I would do it. I mean, if I knew that this would be a roadmap to me to, take some holistic, so let's talk about some of these holistic supplements. We've got about a minute left. Let's talk about some of these holistic supplements. What's the first number one for someone who is living a regular life, maybe a little bit of stress? What's a good supplement to take that is across the board beneficial for everybody?
Well, let's take the vitamins first, Lily. The vitamins that come up most often are vitamins A,
Mm-hmm.
E, C, D3, Laetrile, which is called B17,
Mm-hmm.
and CoQ10, resveratrol. Those are some common ones, Lily, but obviously there are others like B1 and so on. Now, the herbs that come up most commonly would be turmeric or curcumin.
Okay, so why don't you hold that thought, because the music is playing right now and I want everybody to hear it, but we said turmeric and curcumin. So we're going to continue our conversation with Dr. James Forsythe and listen to some more hopeful stories of recovery when we return worldwide at whenyouneedafriend.com. We'll be right here waiting for you. Last segment. And we're going to learn and grow one last segment together.
And I have a brain cancer as well.
Oh, you do have a brain cancer. Okay. So, Dr. Forsythe, right now we have a little bit more time before we do the recording. You had talked about turmeric and curcumin. Is there any other herbs that you recommend?
Yes, like quercetin. Quercetin is a big one.
Quercetin? How do you spell that?
Quercetin, Quercetin, and then some algae products like fucoidan and hucoidan, and then a product called DCA from Canada, which is dichloroacetate, which is single-handedly reversed childhood leukemias.
Wow. It's amazing.
And, I could go on and on. There's so many.
Yeah. So here we go. So our last segment with Dr. James Forsythe.
Friend, you can count on me. I'll be right here waiting for you.
You can text Lillian McDermott or leave her a voicemail at 407 888-373-5959. Once again, here's Lillian.
Welcome back to the Lillian McDermott Radio Show, where we always learn and grow together. Today's teacher is Dr. James Forsythe. He is in Reno, Nevada. I know that what you're hearing today may be as foreign as learning way back then that the earth was a sphere. But I assure you that if you do the research, you will discover that there are other doctors like Dr. James Forsythe. Dr. James Forsythe was the first one to open my eyes to the new truth. The evidence was so compelling, I could not ignore it anymore. When you do have a cancer diagnosis, or if you do have, hopefully you'll never have one, but if you, with lifestyle and choices that we make, stresses, sometimes you will get that. If your doctor says that the only answer is chemotherapy, radiation, and surgery, fire them and find a doctor who will treat your body, not the symptom. So Dr. James Forsythe, I want to share with you, also has a foundation that will help you, just like the McDermott Holistic Healing Foundation. He's way ahead of me. And so the people that are going through the clinical trial, Dr. Forsythe, how much does it cost someone to go through this clinical trial?
We have three options. Some of them save a third or a fourth, and with the foundation, that you can lower the cost to half. And it's pretty much dependent, Lily, on what drugs came up, because the older drugs are cheap, the newer drugs are quite pricey.
Okay. So, and if somebody doesn't have a Dr. Forsythe near them, because people from all over the world are going to be listening to this and watching the YouTube video later on, can you do, a phone consultation with them and help them with the results once you get that Greek test?
Absolutely, and there's no charge for that.
You're amazing. You're amazing. For those of you who would like to get to know Dr. James Forsythe, the name of his clinic is Forsythe Cancer Care Center. I gave a different website earlier, which will link you to drforsythe.com. I will have his information on the website after the show. Now, Dr. Forsythe, you are very passionate about cannabis. And so you have some examples, or you have an example you'd like to share of someone who had, I think you said kidney, that had kidney cancer.
We have a testicular and kidney tumor.
Okay. So how does cannabis help with cancer treatment?
Well, cannabis oil, and if you refer to my book called Stoned, I give the whole history of it. It's been out there as a bestseller for the last 2 years.
Yes.
And we use it as maintenance therapy, Lily, so that after their 3-week treatment, we put them on the oil, which can be delivered on the gums or rectally, or in women as a vaginal suppository. So all of those means work, but it has to be the proper ratio, and the best ratio, and this is extremely important, the best ratio is THC to CBD, a 2-to-1, 3-to-1, or 4-to-1 ratio, with THC always predominating.
Okay, so 2, 3, or 4-to-1.
Yes, that is the magic. It has to be those. The Israeli scientists have figured this out.
Yeah. I'm sure the FDA won't even let it near here, because it does change the big moneymaker of the cancer industry. So it's really sad. I'm not a political person, and I don't discuss politics, but you just cannot help mentioning that, at least when we talk about cancer. So let's talk about the protocol of these patients that you use. Is that all you used, or did you use other modalities along with the cannabis?
Oh, no, we always use the other modalities first, and the cannabis as a maintenance therapy for 6 months to a year afterward.
Why do you think it works so well?
Why does it work so well?
Yes. What's the science show?
The science shows that the two agents, which remember in the cannabis plant, there's over 400 chemicals.
Mm-hmm.
The two tetrahydrocannabinol, which is the party drug, CBD, which is the healing drug, have to be together. They work in tandem, or sometimes called entourage.
Mm-hmm.
Entourage means travel together. They attack the cancer cell and they disrupt the mitochondrial operation and several other metabolic things and cause apoptosis. And they even work for brain cancers.
Wow. Okay.
Keep that in mind. Now, here's a case I'll tell you.
Uh-huh.
JC, 24-year-old white male, very handsome, from Southern California, was diagnosed with testicular cancer 2.5 years ago. And he was treated at the USC Norris Cancer Center, very highly reputed.
Yeah.
They could not control his cancer. His tumor marker, HCG, was over 29,000. It should not be over 30.
Wow.
He came to see me. He did my genetic testing and my 3-week protocol, and I put him on cannabis oil at the same time because he had brain, chest, mediastinal, and bone mets. We got his tumor marker from 29,000 down to 400. We then decided, in consultation with the Norris Center, to send him back there for a stem cell transplant, which he had successfully. They said that they had never had a patient that did so well with the transplant.
Wow.
He's alive and well today.
That's amazing. And that was 2.5 years ago. Was he sent home to die? Is that what happened to him?
Oh, yes. We came here with a death sentence on his back.
Okay, so here's that death sentence, Dr. Forsythe. How important is it for someone to want to live? When you're working with someone that has been given this death sentence, or anyone who's been given a diagnosis of cancer, how important is the mindset of the individual of wanting to live?
Extremely important. The patient must be positive and must have a real desire to live. And actually, denial helps. Patients who are in denial actually do better.
That's the one time where denial really works, huh?
And denial is not a river in Egypt.
That's very good. Yeah, I think that what Dr. Forsythe is meaning is that the denial that you're going to die, that someone has told you or planted that seed that you're going to die. It is so important that we hold on to the hope, Dr. Forsythe, that you're always giving to all that walk into your place. And I'm so grateful to you and to everything that you've done. I'm going to give the number again for Dr. Forsythe in Reno, Nevada. Is 775-827-0707. This is an opportunity. He has a foundation for those of you who need help. He can counsel over the phone. He can help you in so many different ways to bring life, hope, and healing back into your life. It is tragic. All the hundreds of thousands of people who had been led to slaughter. And you know what? If you've done chemotherapy and you've been successful, congratulations. But if you have gone and now you're experiencing the side effects of this horrible sentence, then it is time to heal the body. Dr. James Forsythe, you're an amazing man. Every time I speak with you, I learn something new. Thank you so much.
Thank you, Lily, for your interest and your enthusiasm and spreading the word.
Absolutely. You've got my commitment. And to you, my listening friend, you can't unlearn the truth. Now that you know, do your research. Don't take it from me. Go to PubMed. Do everything you possibly can to learn and grow and heal. This is Lillian McDermott wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.